1. Introduction. In the next few minutes, we're breaking down everything you need to know about the Nipah virus. No panic, just clear, actionable information. Okay, real talk. Nipah virus is a bat-borne zoonotic disease. That means it originates in animals, specifically fruit bats, and can, under certain circumstances, spread to humans. You've probably seen the alarming headlines during an outbreak. It's easy to get overwhelmed, so let's cut through the noise and get the quick basics before we dive deeper. It's a rare but serious illness, primarily affecting the respiratory system and the brain. Understanding how it works is the first step toward protecting yourself and your community. 2. Origin and discovery. Where did this virus come from? The story begins in 1999, during an outbreak among pig farmers in Malaysia. The virus is named after the village, Sungai Nipah, where it was first identified. The natural reservoir, the source, starts in fruit bats of the Pteropodidae family. These bats carry the virus, often without getting sick themselves. From there, it can jump to intermediate hosts. Animals like pigs are a common example. This happens when the bat's urine, feces, or saliva contaminates the animal's environment or food. And from these infected animals, it can then spill over to people, especially those in close contact, like farmers or veterinarians. Direct transmission from bats to humans is also possible, though less common. 3. Symptoms and effects. Knowing what to look for is critical for early detection. The incubation period, the time from exposure to the first sign of illness, is typically 4 to 14 days, but it can be as long as 45 days in rare cases. The initial symptoms are often nonspecific and flu-like. Fever, a persistent headache, a dry cough, and a sore throat. Muscle pain and fatigue are also common. In more severe cases, the virus can progress rapidly. It can attack the brain, causing encephalitis, that's inflammation of the brain, which leads to confusion, drowsiness, disorientation, and potentially seizures, coma, and death. Or, it can target the lungs, causing acute respiratory distress, making it very difficult to breathe. So, what are the red flags that demand immediate urgent medical care? A severe, unrelenting headache, any mental confusion, seizures, significant chest pain, labored breathing, or a sudden worsening of symptoms after a fever. Don't wait. 4. Transmission and spread. How does it move from person to person? The primary route is through direct close contact with the body fluids of an infected person or animal. This includes blood, urine, or saliva. This means it can spread through respiratory droplets when an infected person coughs or sneezes. Being in close proximity is a key factor. It can also spread via fomites, that is, by touching surfaces or objects recently contaminated with the virus, like a sick person's cup or towel, and then touching your own face, eyes, or mouth. To be clear, this is not some sci-fi airborne threat that hangs in the air for hours. The virus is heavy and falls quickly. Sustained, close contact is what truly matters for transmission. 5. Prevention and safety measures. This is the most important part. Here's how you stay safe. In areas experiencing an outbreak, you must avoid consuming raw date palm sap. Bats are attracted to it and can contaminate the collection pots. If you must consume it, boil it first. Be cautious with fruit. Skip any fruits that look bitten, scratched, or have fallen to the ground where they could be contaminated. Always wash fruit thoroughly under running water and peel it before eating. Hand hygiene is non-negotiable. Keep your hands clean. Use soap and water and scrub for at least 20 seconds. If that's not available, a good quality alcohol-based hand sanitizer with at least 60% alcohol is your next best option. If someone in your household is sick, try to maintain distance. Avoid close physical contact like hugging or sharing a bed. Do not share utensils, drinking glasses, or towels. Regularly clean and disinfect high-touch surfaces. Masks are an effective barrier. They help reduce the spread of respiratory droplets, especially in crowded public places, on transport, or in healthcare settings during an outbreak. For anyone working with patients or animals, especially in outbreak zones, personal protective equipment, or PPE, is essential. Use gloves, masks, gowns, and eye protection. Strictly follow your facility's infection control guidelines. 6. Conclusion and awareness. Let's put it all together. Currently, there is no specific antiviral cure or licensed vaccine for Nipah virus. Treatment is supportive care, managing symptoms, providing fluids, and assisting with breathing. Because of this, the fatality rate can be tragically high, ranging from 40 to 75%, depending heavily on the specific outbreak and the quality of available medical care. This is why early medical attention is not just important, it can be the difference between life and death. It improves the chances of survival and helps prevent further spread. Your single best move during an outbreak is to stay updated with official sources like your local health department, the Ministry of Health, or the World Health Organization. Avoid rumors on social media. Follow their guidance precisely. If they advise testing for contacts, do it. If they advise home isolation to break the chain of transmission, do it. If they say to monitor for symptoms for a specific period, do it diligently. This vigilance is our best collective defense. Keep your immediate circle informed with reliable facts. Panic helps no one, but preparedness does. Keep it calm and keep it factual. You now have the knowledge to protect yourself. Use the simple, practical steps you just heard. If this video helped clarify things, share it with one person who might be caught up in panic scrolling the headlines. Awareness is our strongest tool. Stay safe and stay informed.